Hello, everybody. Second to last week. Que triste. We're almost done. Can you believe it? So I wanted to, first of all, Marlene, I want to, it's kind of perfect timing that today we're talking lower body, right? We're going to talk a little bit of lower body anatomy, and I think that'll be good for you. Um, and Nancy, by the way, will be on shortly. She just has, she was at the dentist. So, okay. So what I wanted to do now is, first of all, I just muted all you guys. So if you have something to say, you need to raise your hand. But does anyone have any questions from last week in regards to Natalie's person and what we talked about as far as upper body anatomy, anything like that? And then Natalie, I do want a quick little synopsis on how your gal is doing. But first, let me take questions. Any questions from last week? No? Everybody understand the difference between the shoulder joint and the shoulder girdle? It's important. Okay, great. So Natalie, why don't you unmute and just give us a recap on your session with your gal? How'd it go?
It was great. First of all, thank you all for all the questions. There were some, so that I learned we actually had a very good session. She is on supplements. She's not seeing a functional doctor. She would consider an MD or a DO, but she was very particular. She's on, as we talked about, a lot of pharmaceuticals, and she managed all of that herself until finally she got in with a pain management doctor who has helped, taken things off, and also from a supplement point of view was able to redirect some of the stuff that some supplements were not good for her. So I think we had a follow-up question about supplements, so I just wanted to say that. She did not have a fusion, but she had a microdisectomy. I don't know if I said it properly, but
yeah, discectomy. Yeah, discectomy. She had part of her disc removed, right? She had part of her.
Yes, yeah. I guess the part that was puffing out. And she's had the re-herniation as well.
Because her joint's now compromised because she only has half a disc. Okay.
Right, right. She does not wake up refreshed. Sleep is a big issue. So I can't, maybe I forget who asked that question, but it was such a great question. And so she talked about now it's much drier here because our heat has come on, sort of. So she needs to, and I said, you've got to go to bed earlier. She is, so anyway, instead of saying you need, it's more about working towards change. And so we talked about, and remember I had said she made fun of her genetics. So we talked about positive mantras, and she liked that. She goes, I usually just am making fun, but I was listening just as just a quick aside. I've been listening to the Mamas and the Papas, and there's a song about, and Mama Cass just keeps getting fat is one of the lines. And I was like, wow, whenever that, I had never heard, I'd heard the song, whatever the song was, but I was like, ooh, we think we're making jokes, but when we talk about ourselves in this way, it's a burden. And anyway, so.
Yeah, so do we all remember the first agreement in the 4 agreements? Be impeccable with your word, not just to others, but to yourself. Yeah, so I agree with you. And I hear people all the time say oh, I just call myself fat because I am. It's no big deal. And I was like, nobody says the phrase I am fat and means it in a good way. Right? There's nothing no happy, joyful sprinkles and rainbows around that phrase. It's
right.
Loaded with self-depreciation, right? And it is interesting that you're hearing that, And because I do the same thing, like I call myself a scrawny chicken all the time. I mean, genetically, that's how I am. I'm very thin. I could lift weights until the cows come home. It ain't getting much bigger than this, you know, and that's fine. I'm not looking to compete. I'm not trying to, you know, look like anything, but you know, sometimes I wish I was a little bit stronger than I am, but I'm also 52. So I accept parts of that, or I'm almost 52. So, but yeah, words have power. And I love how Leanne last week had suggested that I am genetically blessed. So I hope that she does mantra that out, because it is powerful. And I think that that's really lovely. Any other questions? Thank you. Thank you. Anything else from last week that you want to discuss or ask Natalie about her person? Yeah, go ahead. Mhm.
Just one thing. So she said, I texted her yesterday to see how are you doing today, and she said she felt really good, but but her ankle was like she had sprained her ankle a couple of weeks ago, and she said that felt very tingly and sort of like not angry, but just like meh. And but she said, but doesn't that kind of make sense because we're working on all of me, which I felt like I remember leaving Red Mountain this summer and feeling like shit. So,
Well, the worst time to be to melt is at a melt training, right? Where you're just melting around the clock and you are going to feel like shit, right? It's like you're tinkering in that part of the brain that you're not supposed to for a really long period of time. So it's going to make you a little funky. That's funny. Well, that, and also remember the whole idea of like a healing transition. I know I had one when I was going through my first melt experience. Has anybody else experienced a healing transition in their melt experience, like as you learn to melt, like old injuries came up? Anybody else have? Yeah.
What do you mean by a healing transition?
So some people call it like a healing crisis. It's just, again, words have power. Like it's not a crisis. It's just so in my case, I had when I was a teenager, I had broken my tailbone. I didn't know it was broken. Somebody, a friend pulled me off a high counter that I was sitting on and landed flat on my bum. And I didn't do anything about it, but for like 15 years, just standing up and sitting down, I was like, oh, but I just got used to it. It was just part of my life. And then one day I realized it wasn't there anymore. And then I went through the melt training. And back then, that's when you had 4 days, a month off, and then you came back for another 4 days. And you practiced in between, which I did diligently. And when I came back, Sue said, how's everybody doing? Did you practice? What do you think? And I raised my hand. I said, never felt worse in my life. Just like you, Natalie, I felt like shit. And I went on and on about all the things that were bothering me. And Sue was like, great, keep going. Because basically what had happened was I sustained an injury that became asymptomatic in dehydrated fascia. So once I started working on rehydrating myself, getting fluid flow back in the body, it woke up certain injuries that still hadn't healed. They just temporarily mummified in a half-healed kind of way. So now if you were to palpate my tailbone, which I would never, ever ask any of you to do, but if you did, it's literally bent in half like this. It's like a coat hanger. It's just hanging. It's just bent in half. So it doesn't bother me anymore. But, you know, now that I melt on a regular basis. So that can happen with some people who are like, oh yeah, I injured myself years ago. It doesn't bother me anymore. And it tends to, once they start getting a fluid flow in, it tends to cause those things to flare. But that's part of the healing process, right? So it could be very frustrating though. Yeah, Denise. I don't know if you're talking.
Sorry, I'm here. Sorry, I can't show my video yet, but I actually just went through that this past week. An old low back injury out of nowhere. So yeah, not even able to move, almost like it was 15 years ago when it happened. But you know, melt has helped keep that at bay, and I've been so strong with neuro strength, but all of a sudden it just showed up. So I was able to get myself back. But it's almost like you backtrack with melt, and you go, like, you take care of whatever's most recent and you're undoing and unwinding. So that's been my experience with melt for sure.
Yeah, I think that's a great observation and personal experience to share, Denise, and it's going to be different for everybody. Unfortunately, with your clients, many of them might say, Melt hurt me. It's not the program for me. I feel worse, so I'm not going to do this anymore. So remember what I said in the beginning, that your story is the most powerful story. Because I share with people all the time about my healing transition. I said it got way worse before it got better. And I almost quit the training. And Sue Hitzman begged me to trust her and stay in the training, which I did. So thank God for that. Does that mean I never have pain ever again? Of course not. I've got a knee flare going on right now. Every now and then my hip bothers me. It just means I have to tweak what I'm doing. Maybe it's I look at the history of my activity for the week. What am I doing? What am I not doing? Sometimes it's nutritional. Nutrition will affect, right? Because any inflammatory foods isn't just going to inflame your belly. It's systemic. It's going to inflame the joints too, right? So we think about like nightshades, like a lot of people can't eat nightshades. Those are inflammatory. They cause the joints to hurt. So it's all part of it. Now, I'm not a nutritionist. I'm taking a nutritional coaching course right now, but I'm still not a nutritionist. So that's outside of my scope, but that's something to consider as well. Right. So I'm glad to hear, Natalie, that your gal is looking into an osteo, which is great. Functional medicine sounds scary to some people, so I get that, but those are all things to consider as well. So it's the whole picture. Okay. All right. So what I wanted to do now is just review one thing, do a quick little look at anatomy, even though for some of you it's old news, but I'm going to look at it anyway. And then I want to see who wants to go into being a case study, who wants to cover their case study. Okay, so today we're talking lower body, right? So let's remember what we spoke about a couple of weeks ago about the spinal engine, because that really does dictate so much of how the lower body moves. Remember that the prior belief was that the legs did all the work and the torso and the head and the arms were along for the ride. And according to Serge Grakovetsky, this is not a universal belief. This is according to one guy and his theory, but it makes abundant sense to me. He's indicating that the spine is indeed the very thing that drives the pelvis, right? So the spinal motion is the same with or without legs. That's pretty good evidence to me, so that does tell a lot. And understanding that lordosis is important to this engine. We have this with lordosis, and the whole idea of axial rotation is evolutionary. And that this is really how we get transfer of ground reaction force to go through our body and our tissues, right? It's all part of it. It's quite complex. There's nothing simple about it, but to just say that muscle is responsible for that and that joints are the only guys responsible for shock absorption is not accurate. It's really not. Thoracolumbar fascia plays a huge role in all the load that we take on with our lower body. That is the energy transfer, right? It's not just the muscles in the back. So when you do things like squats and lunges, you go to pick heavy things up and they say lift with your legs, not with your back. Indeed, you're using your legs, but your thoracolumbar fascia is the one protecting your lumbar spine. So they got to work together in harmony. So remember, you have this equal and opposite kind of rotation thing. You have this, the axial rotation from the lower is going to affect the ones up above as well. So spine, the health of your spine is really important here. It's important for not just the spine and supporting your back and your guts and all of that is responsible for with a good spine that can rotate and support you. It's going to help with the motion of the legs and the arms. Yeah. So if you have someone who's got some knee issues, hip issues, maybe it's not about the knees and the hips, maybe it's about the spine after all. So yeah, so those are, the health of the spine is going to dictate a lot of the health of the limbs as well. I'm just looking here for 1 second. So Liz, you say, so if I have a pain that feels like maybe from my QL, it could be from my thoracolumbar fascia. Maybe that's when you're feeling that, you're talking about pelvic instability. We're going to get to that in 1 second. So let's just look at the anatomy briefly. And one thing I love is like how we consider men's and ladies' legs. Like men's legs are muscular and hairy, and they're meant to do really big manly things. And women are just meant to have pretty legs and dresses, right? It's awesome to have nice looking legs. I mean, I love that, but you know, if you really want them to work right, you need to have stability in the pelvis and stability in the spine. So let's talk about some of the muscles here. So when we talk about the some of the muscles of the pelvis, like we look at the gluteal group, we think the glutes, right? People are like, oh yeah, your glutes. And they just think about getting the lift of their butt, like that whole Brazilian butt look or whatever. That's glute max. That's nice. But you also have medius and minimus. So if we look at this for a moment, what I want to draw your attention to are a few things. So you can see this is from Joe Muscolino's book that's actually from the musculoskeletal anatomy or the musculoskeletal manual. I think a lot of you got his kinesiology book. These images are in there as well. If you want to focus just on musculoskeletal anatomy, that other book is a great one to have in your library as well. But what I love about this, first of all, is how, okay, no, first of all, a human cadaver does not look this clean and pretty. There, I said it. This is an artist's representation of what they feel that somebody's muscles look in vitro, in vivo, whatever. It's an artist rendering. It's not this pretty. However, I love this line, the arrows indicating the line of pull, letting you know how the muscle is contracting. Now, you've heard Sue say it, for those of you in neurostrength, that about 80%, 90% of, let's say 90% of the glute fibers attached to your IT band. So when people talk about, oh, my IT band is tight, it's like, stop blaming something that's a support structure and has no contractile protein fibers in it, contractile tissues. Blame the stuff it's attached to, right? So what is it that's going on in the hip that's causing tightness or tautness, really, for most, in the IT band, right? Your IT band is a support structure. It's not contractile tissue. And then the remaining 10% attached directly onto the femur. So with the direction of the fibers, you can see that it's going to externally rotate the femur in the hip joint, right? So when we do moves like mini bridge, we do knee knockers, straight leg extension, and hover and lunge, we are attempting to get these lower fibers to fire. And we're doing that so that we can have better lift in our pelvis. It's going to actually help lift the pelvic floor and also help with propulsion. So getting into full extension at the hip. Most of us are so hyperflexed, causes our pelvis to be stuck in that tuck. We want to encourage extension of the hip and with that comes a bit of external rotation. The challenge is, can you keep the femur neutral and get into extension? It's kind of an interesting challenge to really challenge those lower fibers. So like when you're lying down, your rest assess, sometimes if we're going to be doing this kind of stability work, I'll actually say, I want you to notice where your pelvis meets the leg. I always say it's like where the oil spill happens for us ladies trying to get into a bikini bottom, where your butt just kind of spills out like an oil spill. Maybe I'm just talking about myself, but that's what I'm talking about. We want to see if we can get those fibers to fire, to get them reignited so that they can help lift the booty a little bit. We don't want a lazy butt. You'll also hear about things like heart bottom syndrome, where like literally a woman or a man too, they're so like, it's like they just look so dominant here. And that's just like this, it comes down into this thing down at the bottom. It's weakness, stuck in a tuck, gripping the butt. Not good, right? So that's the glute max. Then you have medius and minimus. And really it's all the same tissue, right? Again, it's not this clean and easy to separate, right? It's almost impossible to separate. I mean, you've got a knife, but that precision can be really hard to separate, at least for someone like me, but I'm hardly a master dissector. I'm not even a mediocre dissector. I'm just plain terrible. So what I want to point out about the glute medius and minimus is that it's also known as the deltoid of the hip. So if you think about your shoulder muscle and your deltoid muscle and all the fabulous actions that it does, your glute medius and minimus does the same thing. It's obviously much more superficial than the deltoid, but it is going to flex the hip. It's going to extend it. It's going to abduct, meaning have it go away from the body. It's also going to cause internal and external rotation, as well as hip depression. So for those of you in neurostrength, when we do moves, the moves that we are doing to try to get this sucker to fire are side leg lift, side hip hero, monster side step, plie squat, and even the releve and the accordion fold. Those two moves are actually great assessors to notice if lateral hip stability is functioning properly. And if you're terrible at your releve or you're terrible at your accordion fold and your knees buckle in, along with inner thigh weakness, also lateral hip stability is failing. And why does this matter? Well, if you're going to walk up a flight of stairs without your knees taking the brunt, you really want to be able to have the femur stay secure in the socket. And as you're going up the stairs, have the lower fibers of glutes be the ones to help propel you up the stairs into hip extension, rather than just letting it all go into your lower joints. So the importance of this group is very important. It's not alone though. We also have other things going on here, like the deep hip lateral rotators, right? So also known as the deep six. Everyone's obsessed with piriformis. They're like, oh, my piriformis. I'm like, yeah, well, your piriformis has 5 other friends and they all live in this tiny little apartment, and their job is to help with stability of the femur in the hip socket, as well as be the prime mover of external rotation in the hip. And what does that sound like? Well, it sounds an awful lot like the rotator cuff, right? So this is kind of like the rotator cuff of the hip. So if you remember from last week when we went over the sits muscles of the rotator cuff, this is the same idea, because you actually do have quadratus, obturator externus, you have the internus. So you do have musculature that helps to just stabilize the femur in there. It helps to externally rotate, but really this is about just get the femur in the socket. So when we do moves like clams, for instance, right? Or even one of the add-on challenges for mini bridge is to encourage a little external rotation while being up in a bridge position in terminal hip extension. So obviously the hydration for both of these, seated compression, you're gonna hit all this area, right? You're gonna juice it up really nice, and in turn juice up the sacrum, which is important because with all of this, yes, it's about the femur getting in the socket, but it's also about getting the sacrum to be stable and the SI joints to be evenly balanced. Again, this whole idea of IT band syndrome, give me a break. It's called pelvic instability. There's like, stop pointing a finger at your poor IT band and having people roll on it and inflict pain, and it's just terrible, right? So if we put it all together, it just looks kind of like this. Again, artist rendition, but I like it. I think it's a pretty picture, gives you a general idea so that you can have this in your brain as you're cueing through things like seated compression and all the neurostrength moves. You'll notice that nice yellow thing called the sciatic nerve. How many of your people say, I have sciatica? And you have to ask the question, oh, do you have a bulging herniated disc in your lumbar spine? And if they say no, they do not have sciatica, they have piriformis syndrome. So if you have pelvic instability, not only will your IT band start to trouble you, but you're going to get most likely a clamping down of the piriformis onto the sciatic nerve, which is going to cause referred pain all the way down the leg. So instead of, people digging in and trying to dig out whatever, all they're doing, like people who, like my sister's one of them, she says, I have butt-itis, and she will stick her butt in the corner of the dining room table. And I'm like, stop doing that. You're actually irritating your sciatic nerve, but she won't listen to me, right? She's like, but it feels good. I'm like, so does cocaine. It doesn't mean it's a good idea. right? That's a quote from John Sharkey. I always thought was really funny. So I'll just quickly cruise through these because I don't want to spend a lot of time talking about anatomy, musculoskeletal anatomy. That'll be next year. If you want to take the classical anatomy with me, you can. But you've got muscles at the hip joint that are going to flex the hip. A couple things I do want to point out. Tensor fascia lata, this little sucker, again, attaches to the IT band. It's hip's little helper. And this thing gets locked short and stays locked short when we sit at a desk all day long. Yeah, or drive a car. Lower fibers of glutes get soft, they get weak, right? Psoas gets exhausted, right? And I love how they call it the ilio-psoas complex. The two functionally have literally nothing to do with each other. They just happen to be near each other. So some anatomists thought it'd be great to call it a complex. They have completely different functions based on the fact that your psoas attaches to your spine and its fibers are completely continuous with the diaphragm, right? Your iliacus does not do any of that. It's a stabilizer. So you have muscles of the thigh, you have your hamstrings, your quadriceps, your adductor group, right? So anyway, back to this. Sorry. When we do moves like mini bridge, we're trying to get this to lengthen out. When we do bent knee press, same idea. We're trying to get tensor fascia lata to quiet down, right? When we do all the core work, right? Like core challenge, advanced core challenge, we're helping to stabilize and quiet down the psoas. When we're working on muscles of the thigh, we have so many moves we do here. For those of you who took my mega map yesterday, we worked on seated straight leg extension, and that's to get vastus medialis to fire and vastus intermedius, the center thing gets really weak. So Marlene, I don't know if you're doing seated leg extension. This is a great way to help track the patella. So something to make sure I need to do it more because my knee's been bothering me too.
Yeah, but
Okay.
I'm not level 4 yet, so I don't know that move.
You can find it on Melt on Demand, my love, or
Okay.
you can just take my class and learn how to do it there. You don't have to be trained to do it, right? Otherwise, we would have no clients.
Okay, thank you.
So then you have all your inner thigh muscles. These are important. Look how this is pectineus, attaches right to the pubic ramus. So if you're doing inner thigh lift right, if you got that move right, you're going to feel it right up in the crotch. And that's a good thing. That's what you want to feel. This is part of your rooted core. It's part of pelvic stability. It is essential to get these muscles hydrated, juicy, and firing properly. They get weak. When they get weak, we end up with all sorts of problems, right? And you have your lower leg. The lower leg, we don't really address as much. One of the moves we do to address this directly is the shin glide and shear. We get in and get out because, again, talking about a tiny apartment, you got a lot of people, you got a lot of dudes living in here, all in, and literally they are called compartments. So you could say there are a bunch of them living in different compartments in one itty bitty building. And what is important to understand here when you're talking about the lower leg is the amount of fascia that's in here. Number one, the intermuscular fascia. So we see like tibialis posterior. I mean, it's mostly just fascia. You see it in a cadaver dissection. Yes, of course, there are protein fibers, but it's like this is the interosseous membrane. So there's a lot of tender stuff in here. If we look at the, that's the posterior view. If we look at the, do I have an anterior view? Where'd it go? Lateral? No, that's posterior. No, I don't know. There it is. So if you think about also the fact that this needs blood flow, it needs nerve supply, right? So you have all the big vessels like your femoral artery and femoral veins and the nerves and all of that then come down, branch behind the knee and go into lateral and medial compartments to innervate and supply the lower leg with blood. When you do have something like you hear about compartment syndrome, when somebody gets kicked in the shin, soccer players get it a lot. Who was I talking? Oh, Kristen Johnson was saying that in the off season of cross-country skiing, there's a lot of like the inline skating, and the impact of those skates onto the hard ground reverberates a vibration into here that causes inflammation. And when you end up with inflammation in your lower leg and you end up with compartment syndrome, it's going to start choking off the blood supply and the nerve supply. That's not good. If it chokes off the blood supply, you end up with necrotic tissue. Necrotic meaning dead. It means that if you do nothing about it, you're going to end up with an amputation. So if you end up with, I'm not to alarm anyone, but if you have someone who says, I have compartment syndrome, they've been diagnosed with it, find out what they're doing with it if they've probably been cut open. You want to try to avoid anybody, for the love of God, ending up with a fasciotomy, which is cutting the fascia in order to give room to the blood vessels and the nerves so the leg doesn't die. Sometimes you have no choice, but we want to stop it before it gets to that point, right? So just things that are important to understand. So when you have lower body issues, you're going to have more than just the leg pain, right? You're going to have back pain, pelvic pain, hip pain, shin splits, compartment syndrome. I spoke about that. You look about like ankle sprains and strains, that's going to affect everything going up, right? It's going to affect the whole chain. So keeping that tissue stimulated with foot treatment on a regular is so important. Foot pain, no joke, again, but if you have things like plantar fasciitis, again, you got to look farther up the chain. You can't just look at the foot, right? That's the victim. Where is the culprit coming from? And if left unaddressed, you can end up with bone spurs, which are terrible. Bunions and neuromas. Sue just did a whole Facebook Live on neuromas, talking about how mostly it's women. And we live in these, we let our feet live in these tiny little shoes, as Tom Myers calls them, little coffins for feet. I think that's the best way to put it. As we get older, that starts to affect just not only, causing a neuroma, but also hammer toes, you get bunions. It's a mess. It's a mess. Like, set your feet free, for God's sakes. Something as simple as advising your clients to take their shoes off in the house. And if they're like, my floors are cold, or the floors are too hard, like Florida has all like hard flooring, get some slippers, right? That allow your foot to spread. Just get something, right? Something. Don't wear sneakers and all that crap in your house. And for God's sakes, flip-flops are the worst, right? So all sorts of things, peripheral vascular disease, neuropathy, restless legs, so many things can go wrong. So we have our melt solutions. Again, looking at the spine, it's important. I would say, can your client can they do a spinal flex assess? We don't really do that so much in melt anymore, but I can show that. Hip hinging, of course, looking at any of the issues with the major joints. What does the person do for a living? That's going to give you a lot of information. Again, we have sports, we have injuries, x-rays, MRIs, health history, and the rest assessed will give you a lot. And of course, we always do indirect before direct. So that's my bit there. What does this say you put down, Bruce?
Oh, it just reminded me, it's a video on the pelvic rotator cuff that you talked about. I hadn't looked at this in years. And anyway, I just posted it up there for people to download and take a look at. It's an old animation thing. I haven't looked at it in a while, but it could be interesting for you guys to look at.
Fantastic. Yeah, I'm downloading it right now. Thank you for that pro tip. I love it. Yeah, rotator cuff of the hip. Nicole, are you drawing the deep 6 lateral rotators? Are you painting that?
Absolutely.
Oh,
When I had plantar fasciitis, they told me, and I thought this was dumb, but I tried it. They told me to wear shoes in the house. They specifically said, you have to get shoes. You have to wear shoes in the house. And like, I don't normally wear shoes in the house. So like, I went and I got these like really like, shoes that were really like, I don't know, they had like a good arch support, like all this stuff, whatever. I managed to wear them for a couple days, and then I was like, this is ridiculous. I can't do this. But I just don't understand like why that would help anything, because if it's really tight.
Right. You have to remember ground reaction force, right? That whole idea about meeting the earth coming back at you, and the flooring that we have in our homes is not the earth, right? They're hard surfaces, and it can be hard on feet. So, it's too bad. Like, I mean, it's good. We need roads, right? We need paving and all that. And we need foundations on houses, but it can be problematic. That's why carpeting is a good idea, but I don't like carpeting either. Like I've got this carpet in here and it's gross and it smells and I don't like it, but, that's why I say like then wear some slippers, but like wearing a pair of sneakers in your house, dress shoes in the house, like no, take them off. Or if you're going to wear shoes, wear like minimal footwear. Like I've got these guys, these are the Vivo barefoots. These are my workout. Shoes. They're minimal.
wear shoes.
You gotta work your way up to these, and they're very wide toe box, and that's great to allow your toes to spread. It's the problem is the shoes that cause a choking off of the toes, and don't allow for the bones to move. You lose that. That's why we do position point pressing, right? To get mobilization back into the joints of the feet. We have so many joints in those feet, and and you get muscle atrophy. So of course you're going to end up with inflammation and pain. See, Michelle, I have a client who has made improvements, but we're not quite free from back pain. As soon as I got her off the floor, off the flat flip-flop, she made more progress fast. Yeah, flat flip-flops are terrible, mostly because you have to grip your toes to hang on to it. So it's just causing an irritation in there. Bruce, do you have any thoughts on this as far as like clients that you treat who have foot issues?
Well, as with regards to wearing shoes inside and plantar fasciitis, I can rationalize out that wearing shoes inside on those hard surfaces might allow the foot to roll through a natural movement, utilizing all the arches, as compared to being without shoes and on that hard surface. And when that happens, we utilize that whole posterior line of our leg in order to allow the articulations to happen from up our leg down into our foot. So I can rationalize wearing shoes inside for that. The flip-flop thing for sure.
Yeah.
I mean, that is something I've been working with on me for a long time, is I tend to hold on to the earth with my toes.
Yeah.
And that changes my whole ability to function from the ground up through my body. And so having that ability to thinking about wide toe boxes, feeling into the earth with all medial lateral arch, that tripod of, great toe, lateral arch, just the metatarsal of the little toe, and then down on the heel, feeling that tripod effect and rolling through that. In my mind's eye, every now and again, I have to go to that movement process. And
Have you done any of the standing level 4 stuff like the releve?
no, I have not.
Yeah, that would be a valuable one for you. So
Yeah.
you haven't taken any of my classes that are for you to take at your leisure?
I have not been able to do that yet. I know.
Tisk, that's all right. But we do that, especially in week 2. So learning how to do a releve would be really good for you. That's a good thing as well. But yeah, it's a great point. That whole idea of, and it's not only just structurally not a good idea, it's exhausting to the nervous system, right? To use that kind. Remember, muscle energy is very expensive. Any other questions on this? Anatomy wise, we feel pretty good about understanding the role of the hip stability and how that could cause a lot of problems with that. Yeah. Marlene, are you doing seated leg lift? Are you doing that move at all? No. Okay.
No, that's what I told you. I did not level 4, but I'm going to look it up. And now that the links that you sent for your maps, I do them on Sunday because then I have time. So how long are we going to be able to access to that?
Oh, I'll leave them up for a long time. I don't know. I always forget to take them down anyway.
Okay.
Yeah. So, okay, cool. So, all right. Who wants to be up today? Who needs help talking about their case study today? Barbara? Okay. So cool beans. So it's about 20 till. Do you guys want to take a pee break now? Take a quick little bio break? No, you want to keep plowing through? Let's plow through. Okay. And then what I'll do is in about 20 minutes, if Barbara takes a breath, then we will go ahead and and go do our break. So let me spotlight me. And then where'd you go, Barbara? My list of people. There you are, my dear. Add spotlight. All right. Okay, my dear, you are on. What do you got?
Well, I have a lovely client named Nanette.
Nanette?
Nanette. She's an interior designer, and
Okay.
she's 76 years old.
Okay, hang on. I got to catch up to you. And you might need to talk a little louder.
Okay, I'll try. I don't know why mine is always so soft. Figure that out.
I'm gonna bring this a little closer. All right, so we have a female. We're gonna keep her nameless. All right, so female. You said, how old is she?
76.
Okay,
And she has spondy.
okay.
L4, L5, which refers, she gets a lot of tingling, lower back pain. She also has arthritis in her toes and fingers.
She has arthritis. What kind of arthritis?
Osteo.
How long has she had that?
Well, she's had the spondy since 1998.
Okay, that's a long time.
Yeah, and then.
By the way, everybody, if you have questions while Barbara's, like if you have questions that you want to ask about her client, just unmute and ask the question. I don't have to be the only one asking the questions. So group involvement is key. Okay, so what else you got? Okay, so she's a female, she's 76. Does she work?
Yes, she's an interior designer,
You said that. Okay.
but semi-retired.
Okay.
She also has a knee issue. Just just a cranky knee, probably arthritis.
Both of them, one,
One knee,
what side?
left knee. And I think she has gotten shots in her knee.
You think or you know?
I know she has. Yes.
Okay, what kind of shots?
Cortisone.
Okay. When was her last cortisone shot?
I would say 3 months ago. I haven't seen her in a while because she's been out of town. So
Okay.
it's been quite a while since I've seen her.
Do you know how often she's had cortisone shots in the knee?
3.
In how long of a period?
Probably in the last 2 years. I would say 2 years, yes.
She married?
So on the emotional side, her husband passed away 2 years ago, and also her daughter passed away 2 years ago.
Oh, God.
Her daughter had pancreatic cancer at the age of 30. And she also lost her husband within like 6 months of that,
Yeah, he probably died of a broken heart.
probably.
Oh, that's so sad.
It's so sad.
Okay. Anybody have any other questions right now for Barbara? Okay, what else you got?
Does she sleep?
Yes. Well, she says she sleeps an average of 8 hours per night, and she wakes up feeling refreshed. She said she does have difficulty falling asleep. Quiet, quiet, quiet.
Hard time falling asleep. Okay.
Does she exercise?
Well, she's trying to exercise. I'm sorry about my dog. I'll have to kill him soon.
All right, so she does exercise or she tries to exercise?
Well, she wants to strengthen her core. I'm sorry. But she comes to me to do more body work and melt. And interestingly, she discovered melt before I did. Um, so she's done melt for many, many, many years.
So the answer is no, she does not exercise.
Nothing. She put down yoga in her thing, but I don't really
That's
think
not exercise. I'm
Yeah.
sorry, I hate to say that, but it's not exercise.
and she wrote walking.
Okay. Do we know how often she walks?
No.
Okay, I would ask that question.
Okay.
Okay, so we're assuming she does no strength training.
Right.
Okay. And minimal cardio.
Right.
What does she do for fun?
She hangs out with her granddaughter. But she does do a lot of traveling. So she's with friends a lot. She's still brokenhearted about her husband and her daughter. So I think she just tries to be occupied and keep herself busy with
Yep.
other people to help take her mind off of things.
So how is she then in her rest assess? She doesn't like, does she have trouble laying still in her rest assess?
No, she's pretty good in a rest assess.
Okay, all right. Does she have support groups, therapy, anything like that?
No, just her family and friends.
Okay, so she's just roughing it on her own.
Yeah.
She does it in red because this is the red flag. For sure.
Mm-hmm.
Okay. That's a big lifetime event that's going to impact a lot. What else? Any other questions?
So I do have a question. So is the only thing she's feeling in her upper body the tingling of the fingers? How are her shoulders like? Because, I'm just with all that sadness, I would think she would be having something. How does her upper body feel?
Yeah, the tingling, just interrupt. The tingling is in the lower body.
Right.
Because of the I can never say it, spondy.
That's why I say spondy.
Oh,
Yeah.
okay. I thought you said fingers too.
No,
Sorry.
she's
She has
got
arthritis in her toes and fingers. She has
Okay.
osteoarthritis. Uh-huh.
So how does she feel in her upper body?
She doesn't complain about her upper body.
Okay.
It's more like low back pain and then some leg pain and some like nerve twitching.
Okay.
And I think my main problem is that I'm just scared to do certain things with her with the roller.
Okay.
That's kind of like the issue I want to deal with is how do I treat her? I'm scared to put her on a full roller, and
Okay.
that's where
Okay. So, but she has been melting with you, yes?
Yes. Mhm.
For how long?
A year.
Okay.
But
So,
she has melted through the years. She used to melt with Sally. I don't know if you know Sally Huber.
yes, I know Sally Huber very well.
Yeah, so she knew Sally from way back when, and
Okay.
that's when she started doing some melt
Is that in Chicago or California?
in Chicago.
Chicago, that's right, because that's right there.
And then Sally moved, and then
Right.
a couple of years ago, she just like found me on the website, and so she does stuff at home. She does the hands and she does the feet regularly. She's good about doing that.
Wait, somebody had spoken up and I think you got cut off, whoever it was, speak up again. Was it you? Cal?
No, I had just said, does she take any, like I know people with osteoarthritis that get like shots for their arthritis or take regular medication. Does she take anything for her arthritis?
I don't think so. It's a good question.
Did she list any medications?
Let's see. She says she takes supplements and she has seen a nutritionist. But as far as medications, I don't know what she takes.
Okay, so Barbara, that's important to ask. When you go over, so if anybody has like, if they talk about things like spondy, arthritis, bad knees, and they're getting shots, ibuprofen is a drug.
Yeah.
You need to know how much are they taking? You know, it's important just to ask, say, so you're not on any medications because you left that blank.
Hmm.
She's also grieving. Is she on antidepressants?
No.
Okay. Like, does she take weed? I don't know. Does she drink alcohol? Anything like that? No?
She drinks wine.
Okay. If she's drinking too much, she won't be honest about that on her form, but we're gonna assume she doesn't do that. I'm just saying in general. People who over imbibe don't confess it. Oh, hi Nancy, you made it. Yay. How are your teeth, my love?
Can you put me as co-host, please?
Just did.
Thank you.
How are your teeth? They okay?
Perfect, perfect health. Thank you.
So no meds as far as we know, but Barbara, you might find out something different. I would just make sure,
Okay.
Amanda, I have a question.
Yeah.
To Barbara, you say that she's melting for a long time.
Mhm.
Didn't she do anything on a roller? Because you say you are afraid to put her on a roller.
Well, I have put her on the roller. I usually use the half roller with her.
Yes.
But when I do stuff with her, I'm like, well, did you used to do this with Sally? Did you go on a full roller? And she'd say yes. But I just want to make sure that that's a good thing to do for her at
Yeah,
this
but-
point in her life.
But why do you think it's not a good thing?
Well, because if her vertebrae are not set correctly, I'm just afraid that it might irritate the nerve, or I don't know.
But
That's
is
why I'm
she
here.
practicing melt at home with a full roller or not?
No,
No.
she just does the hands and feet.
So she doesn't have a roller, period.
She does have a roller, but she's not using it
Okay.
at home.
And
Why doesn't she use it?
Pardon me?
Why
Why?
doesn't she use it?
I think it's just that she just doesn't think about doing that.
Okay,
I think she just does her hands and feet.
okay. Any other, did somebody else have another question? I thought I heard a voice.
I think, does Nicole have a question?
Nicole,
And
I
Go
do.
Okay. go ahead.
Sorry.
Can she I mean, what's her in a physical sense? Can she navigate her body weight well,
Yes.
where you wouldn't want to put her on a full roller?
Yeah, she navigates well.
Okay.
I just don't want to hurt her. I'm just like nervous about doing something that would hurt her.
Okay,
I don't have the confidence
okay.
with her
Okay.
condition. That's what I'm.
Yeah, that's what I'm hearing. I'm hearing that this case study almost in a way is more about Barbara than it is a case study.
That's why I'm here.
That's awesome. No, and I love that. I love that because it is, I get that when you have someone who's got some issues and hers are actually not that big of a deal, to be honest. I mean, I'm saying that they are a big deal. But her spondy, that's like, you're gonna find that in so many elderly people. And there are plenty of people. Anybody in this group have a case of spondy? Michelle, is that you? Did you raise your hand? No,
No, I just don't know what spondy is.
it's I can't say it right. Bruce, can you say is it spondylolisthesis or something like that? I never.
Yes, spondylolisthesis.
Spondylolisthesis.
You have two vertebrae, and if my watch hand is anterior body, that vertebrae slides anterior in relationship to the other body.
So it's an
vertebrae.
unstable joint.
Okay.
Yeah, and if my finger here is the nerve coming out between the two in that foramen, you can see how that nerve might get irritated or, just influenced by that bone sliding forward. So there may be an irritation there, an inflammation, or, an actual nerve compression happening.
Okay.
So Chris, you work with spondies a lot. Have you ever had any issue with somebody lying on their spine?
No, I live with spondylolisthesis, and it's really not an issue per se. I thought it was for a long time, but it was more in my brain than in my body, for my experience.
Right.
And the things that I would be cautious of that we don't do, that I'm simply a level 1 right now, is being on a roller might be good for her, and that tuck tilt would be fabulous for her in order to do that kind of thing. I'm cautious with folks that have spondylolisthesis and myself being prone and, doing pressing. I try not to press on the spaces, as we call them in MELT, at all in the low back. I make press above and below in order to get some articulation happening. But as far as having her on a roller, supine on the roller, I think that would be really helpful for her.
Just for you who don't know that language, prone means on your belly, supine means on your back.
Yeah.
Okay. So Barbara, yeah.
Full roller, so a full
Yeah,
roller.
it's a full roller. I mean, the worst thing that can happen is she gets halfway through the rebound sequence. She says, "This is bothering me."
Mhm.
You get her off.
Okay.
If you want to, you've got the half roller, flip it over. Flip
Okay.
it over, see how she does. So definitely full roller, need to get that in there. And I loved what Bruce said, because he's absolutely correct that her tuck and tilt is going to be very important to help her with the low back pain.
Mhm.
If she's lacking differentiation, her pelvis is probably stuck. So I love that she's doing the hands and feet at home on a regular basis, but that girl needs to be getting on the roller. We're going to build the map in a minute, but what other ideas do we have for Barbara here?
We have Bruce, Marlene, and Nicole with their hands up. So if they have
Okay.
anything to add.
Who wants to go first? I can't see, Nancy. Who's first in line? You call on.
Nicole.
So I had a spondy. I came about because I had arthritis in my facet joints, and it just pushed the vertebra forward. And the one thing that helped me the absolute most, and I would literally be in so much pain in the middle of the night, I would get up at 3 a.m, do these, were the fetal 5 of Pilates. So it's like a bunch of different clamshell style exercises. And I would just like drop on the floor, like 3 a.m, drop on the floor, do them, go right back to bed. And it was amazing. The pain, like how much the pain subsided. I eventually got what do you call it? A fusion, because it just got too bad. But that was so helpful.
Do you know anything about that, Barb? Yeah, me neither.
Clamshell, it's basically just clamshells working on the glute med, really. The stronger your butt is, the stronger the glute medius is, the more it takes the pressure off of that part of the spine. Because mine was L4, L5 as well. And when I went in to get my MRIs, when I was looking at different surgeons and stuff, one of the surgeons said she'd never seen.
Oh, you froze. She'd never seen something. We'll never.
She'd never seen a butt that was so strong in somebody that had such a bad back like mine. And it was because I was doing those gluteus medius exercises.
Okay, when you say clams,
Mhm.
like neurostrength clams?
No, just like when you exercise clamp, like Pilates, like exercise, you just lie on your side, open, close, or like first you just, if you Google fetal 5 Pilates, it'll show you the whole thing. It's 5 exercises and they all, they're slightly different, but they're just really helpful.
Okay.
And it's just, yeah, just 1, 2, 3, 4, like it's, you don't have to think about it too hard. Just open and close, just make sure that you're engaging and your like hips are stable. You're not collapsing into it, like with, with neurostrength. But it's just like a quicker, you're not trying to reset the nervous system or anything. You're just trying to work on your glutes.
Gotcha. Okay. Bruce.
Okay. I put my hand down, but I'm still
Oh.
thinking, no, I'm still thinking about, I don't want to jump in Marlene's space there, but, I'm thinking level 1 stuff here too. And just the 3D breath and the 3D breath breakdown to get her mind's eye dedicated to that potential of stability in that exhale and that support that is inherent around her spine. Just to reframe that it's not a weak link in her chain, that there's stability there and she should trust it and allow that support to happen. My 2 bits.
Good. Marlene?
Okay, I had a question to Barbara. What level are you for the MELT training?
Level 3.
You are level 3. Okay, so
Yeah.
you know the neurostrength.
And then I was about the spondy. I thought that it's not just like unstable in the joint, but that there is also, when you look at the anatomy of the vertebra, it's the connection between the body of the vertebra and the things that are pointing out, like the progressive spinosus and lateralis one, the transversus. So in this arc, there is a weak spot, which makes it possible for the vertebra to glide. Which
Right,
is
that's
to
the
be
anterior of the facet joints.
yeah. So I think all kind of core stuff, like the 3D breath and even some core activation are just important for people who have that.
I agree. So, anybody else? Nancy, was there anybody else that I missed?
Well, Denise, did you have a question or comment?
I did have a comment about clam. Well, the Pilates version, but I've used clam for my low back and my spine, and that's worked for me. So on that, in the melt world and language, I would definitely use clam. But in terms of right now, I had a thought about breath and the rebalance and connecting the diaphragm to her pelvis and to her whole body. But
Yeah.
I was even thinking single leg lift to play with that in terms of, okay, where is her weakness, right or left side, which is harder for her to do. And then use that and workshop that in terms of trying to find balance and stability of the pelvis. I love single leg lift.
Yeah, thank you.
So I want to address, let me see, anybody else? No. Okay. So let's talk about, let's all bolster up Barb for a second, because she's terrified about doing this with her. She's afraid of breaking this woman, who I want to start by saying, no woman who goes through a loss of a child and then the loss of the husband afterwards and hasn't offed herself is one hell of a strong woman. So you're not going to break her. She's got a pathology. You can totally work around it. She's mobile, she's moving, she's still working, semi-retired. She travels a lot, she moves around. But to me, I say this because she's probably lost and she's in deep grief. So this part of it is the least of your worries. This is my opinion. You've got an emotional person here who's got her own level of fear, being alone. Now her own mortality is on the menu. And I think when you have sadness, grief, depression, it can definitely manifest in the body. Not saying that like her spondyes, she's had a long time, but like the knee, hard time, I'm impressed she sleeps. I don't know how she sleeps with that kind of grief. So that's why I'm like, are you sure she's not on medication? I'd see if she's like not self-medicating a little bit. That's one thing I would just, in as gentle ways you can ask is like, is she like doing the NyQuil thing? Like, what is she doing? Like, just make sure, because that'll wreak havoc on your body in different ways too, as we know. So I just want to encourage you, Barbara, to go in with a different intention. Okay. So instead of being like, I have this skill, which I need to apply on this person to help her with her stuff. This is a woman who's in pain emotionally. Her heart is broken. And
I think that that's why I'm so
Yeah.
reluctant, because I have a lot of complicated clients
yes,
that I'm not afraid of, and I do, but with her, I don't know, there's just something that I feel inside that I just, just care a lot about her.
well, let me ask you this, and if I'm asking too much, and you all jump in with your own questions if you want to, but if this is too personal, let me know. But have you suffered a loss? Pretty great.
No.
Okay, so are both your
I
parents?
mean, yes,
are your
my
parents-
father, I mean, recently or in,
Well, you've lost a parent.
yes.
Okay, I have two. Worst day of my life. To this day, it's the worst thing I've ever suffered,
Mhm.
and it still hurts my heart.
Yes.
And sometimes I say this because I don't know what your relationship is with your father, was with your father. I adored my father. And literally just yesterday during one of Joanne's classes, she said, like the question to ask your inner child. One of the questions was, who is your favorite person? Like thinking about your old days. And I wrote down without hesitation, my dad. He was my favorite person then. He is my favorite person now, and he will be my favorite person forever. And I'm very happily married. I adore my husband, but my dad wins. He will always win. And it's not because he's dead, but he was always like, to me, he was kind. He was funny. He was loving and supportive. He was permissive to a fault, but he was so many positive things in my life. And it wasn't only until he was gone that I was really, truly able to appreciate him. And that has been such a hardship on me. So seeing somebody suffering with something grievous like that is a trigger for me.
Mhm.
I'll start crying. So I ask you, Barbara, is this something that you're afraid of because it's a trigger for you personally?
It's very possible.
Okay, I mean, I could be way off. It's just something to consider, because I would say that Barbara needs to look at Barbara before going back to see her friend. To find out what is it in you, because I don't think she's actually not too, she would probably do just about everything on the melt menu and not get hurt. She'd probably do just great. So I want to bolster you with that, where I think she'll do awesome. You can add in I encourage you to add in performance with her neuro strength. I think she'll really do great. Clams, inner thigh lift, all that stuff. Get her on the roller, get her doing compression, get her rebalancing, all of that. Rebalance is going to be very important. And again, it's like how you add it in. I go back to the red flag of this, that this is your intention, is to bring her a sense of comfort, something to go to when she feels she just can't bear the grief anymore. That's the kind of intention and energy, because I think if you go in with trepidation and fear, it's going to be hard for her to get in her body and really resolve these issues. She's not going to get very far. But I understand your fear. I completely understand it. Does anyone have anything they want to add to that? Correct me on anything?
Denise?
Yeah, I just had a question. Is this client, do you feel differently about her versus your other clients, or do you approach all of your clients with more hesitation in general?
Well, like I said, I don't really necessarily have that kind of fear with my other clients.
Oh, okay.
Yeah, so this is an interesting energetic connection for you, for sure. Anyone else? Natalie, you look like you want to say something.
Nope, I'm good.
Okay.
But I have been in your shoes. I still am in your shoes. So
Good to
I
know.
understand. Yeah.
Yeah. We've all been in your shoes.
Okay.
Yeah.
And I do craniosacral therapy, so that's pretty much how I treat her, as I do.
Oh, okay. Oh, okay. That's a big part of the map here.
Oh.
You didn't mention that. Jeez, girlfriend. Okay, so cranial. So that's primarily what you do with her. You do a combo thing.
Mhm.
Okay. Oh, all right. So she's doing cranio. That's huge. All right. Tell us about that.
Well, I mean, it seems to help her all the time. I mean, I just really do a very basic craniosacral therapy protocol, and she
You mean
loves
like
it.
the 10-step protocol? It's
Exactly.
okay.
I do some myofascial work, and it helps her tremendously.
Okay, great. When you say it helps her tremendously, what's the main benefit that she senses?
I think when she leaves, she's just like, she can breathe.
I love that. So then my question to the group is what melt move simulates, or what sequence simulates that same calming, rebalancing effect of the craniosacral therapy, of getting the cranial rhythm to be a little more balanced?
To rebalance?
Neck release.
I said the rebalance sequence.
Yeah.
My darling, get her on the roller.
Amanda,
Yeah,
can you spotlight yourself so we can see the map?
yeah.
Please.
Okay, sorry, Barbara, I'm dinging you off. I was told to remove the spotlight.
Yes, I want to see what's going on here. It sounds fascinating.
Okay, so I wanted to have Barb on there too. So,
Nobody was spotlighted, that's why. I couldn't, everyone was the same, so.
oh, really? I have it spotlighted on my end. Do you not have it
I don't see the big
Maybe it's
picture.
because she came in later.
Oh, maybe.
It's your fault.
I'm sorry, group. My fault.
That's okay. I was spotlighted. Okay, so is this easier to see for everybody? Okay, so yeah, Barb, you got it. How I would approach it is say, I love how well you respond to our cranial work, the cranial work we do together. So I want to give you something that you could do at home on your own, and you already know how to do it, but I'm going to ask you to do it. Here's a roller. Right? Oh, Nancy, hi. She didn't mean to. I know. It's must be the Novocaine. Yeah, okay. I would say, so take this roller home with you, or have her get one, and have her show her how to do the rebalance sequence. And let me ask you another thing, Barbara. Do you feel comfortable being vulnerable with her and talking with her? Does she want to talk to you about her grief and her sadness? And is it something that you feel okay witnessing, or is it something that emotionally you feel kind of resistant to?
No, I'm totally open.
Okay, I love that. That's great. That's half the battle.
Although I have a question, it's Natalie, Barbara. If you're bringing in, I know we've talked about sort of bringing in her emotions into your own body, and as a cranial, and the massage therapist can talk to this, but are you bringing too much of her into your own body that is adding something?
I don't feel that way with her. I mean, I have had clients that when they project bad energy, that's when I feel like it affects me. But she's a lovely person, and I don't feel like I'm taking on her energy. I just feel like I'm, supporting her. and, helping her and being, empathic and,
Oh, I definitely can see that you're very compassionate and loving. But I think she brings up a good point, Barb, and correct me if you are not like this in this way. For me with craniosacral, and I don't do it full time. I mean, I tuck it into my massage. And I did do only part 1 and part 2 of the core pack through Up Ledger. I still have, I need to go back and redo level 1 and level 2. Before going into somato-emotional release. But what I found was the difference for me doing massage is being grounded and having my energy, like the universe is going through me, spirit is going through me, and whatever that person needs goes right through me, through my hands, right? When I do cranial, I have to listen. And I don't know how to ground myself and listen at the same time. So I have gotten, when I've done just cranial, I've gotten people's headaches, I've gotten their grief, I've gotten their anger, I've gotten all sorts of stuff. So I've like practically fallen asleep, because when that person falls asleep, I do too. Because I just don't know how to ground myself and listen at the same time. So I think to Natalie's question, I don't know if that sounds familiar.
I'm not sure, I don't sense that I take on her energy, but it's possible that I do.
Okay, just something to think about, because it is interesting that you don't feel this way with your other clients, but you do with her. So just some stuff for you to journal on yourself about that. Okay, so we've got about 40 minutes left. So here's what I want to do. If anything else in this menagerie comes up for you guys, write it down so we can talk to Barbara about it a little bit more. And I'm talking about like things Barbara can do for herself before she sees her client next. Any additional things to suggest, any referrals out as an idea. But when we come back, we're going to start building a map, and we're going to keep it maximum level 3, right? Because that's the level that Barbara is. So we can, which I'm excited about. So we can build a really nice map. How often, Barbara, how much of your sessions are melt with cranial?
You mean with my other clients?
No, with this one.
Oh,
So like 50-50? How long are your sessions?
probably like 20 minutes melt and 40 minutes cranial.
Okay. So we're gonna shake things up a little bit for you. Cranial. Okay, so let's take a quick break because I need to go to the bathroom. And when we come back, we're going to start to build a map. Okay, so anything else from this that you guys want to add to, whatever, we can talk about that when we get back. Okay, awesome sauce. All right, where is it? We are going to pause. Okay. All right, so it's time to build our map. So just a couple of other things to ask, and maybe you guys have some additional thoughts on this too. Barbara, did you suggest that she journals her experience?
No, not yet, because I haven't seen her.
Okay, I would maybe give her that as a gift. Yeah, give her a journal as a gift. And say, here's an idea, just give her some suggestions. And let her know, I mean, again, if you're comfortable, holding the space, being compassionate and being vulnerable, just say, just tell her, journal whatever. Don't just think about your physical pain, anything else, any grief that comes up for you, let that be part of it. Let that be part of your therapy, right? Do you have any enhancements? Like, do you use essential oils or anything like that with her?
No.
Okay. I use essential oils all the time in my practice. I don't know if that's something you would consider. It just might bring her a sense of peace, just something to consider. I don't know if you feel comfortable doing that. And additional questions to ask her, like you need to ask her about her meds. I would definitely ask about that. And let's see, there was something else in here we didn't really. Oh, no, I don't remember what it was. Okay, anybody else have anything else they want to add to this tiny little sidebar before we start building our map? No,
I have a question. What is it? I can't read what's in the sidebar. Oh,
it says
enhancements.
journaling enhancements and
Oh, okay. Sorry.
that's okay, that's okay. I'll just do this, and if any other sidebar items come up, we can add them here, okay? All right, so let's build this map. So we already know, so Barbara, you've done a little bit of rebalance with her on the half roller, flat side up. What other moves have you done with her so that we know what's already stuff that she's done?
I've done back up thigh, glide and shear, and the calves. I've done the neck release.
Okay. So you've done kind of like just a beginner's lower body compression. Have you done any length with her? A lower body length?
Nope.
Okay. So that's something I'm gonna add that in the sidebar. So you got to get lower body length in there. And obviously you haven't done any neuro strength.
Right.
Okay. You've done neck release with her. Okay.
And I've done some of the fascial glides. The arms.
I don't know what that means.
The
Do you mean upper body length?
yes, upper
Okay.
body length.
Okay, so you have done upper body length.
Mhm.
Okay. Okay, so these are suggestions of what to do. This is what she has done, right? Okay. So she does hands and feet on her own. You don't do that with her.
Once in a while I do. Yes.
Okay, so you just kind of do little bits and pieces here and there.
Mhm.
Primarily craniosacral is your treatment with her. Do you think she'd be open to doing a full-on map?
Yeah.
Awesome. Okay. So give it to me, people. What do you want to see Barbara try with her gal?
Can I say something?
Yes, you guys are all on. Like, this is your
Okay.
job to build this map. That's why you're here.
Well, I think, once you've done a rebalance with her, she'll have established breathing, her tuck and tilt breathing, core, finding her core. So I think at some point soon, it would be good to start working maybe on her SI joint shear, her maybe a pelvic tuck and tilt challenge, and you could do this on the flat roller or the half roller. I've usually found half roller works better for people that I'm not sure about their challenge, or maybe she might be really tight through her front body line. So like adding tuck and tilt challenge on the half roller, you could either do flat side up or round side up. And then definitely, I think she needs to do bent knee press, because people that have lumbar spine issues have like tightness in their like this, I don't know, tightness, what you want to say, but it's like the psoas and everything is just not always connecting. So that's from Pilates' point of view, I'm sorry. But anyway, so she needs to do that bent knee press, and she also needs to do the, sorry, name's escaping me, the back,
Hip to heel?
back leg length, hip to heel, thank you.
Heel. Yes, that's under the lower body length. So just the 2 beginner length sequences, definitely.
Right,
Okay,
and
awesome.
just even starting with that.
Okay, so how do we want to build it? You've given me a bunch of moves. Now start building it. What are we starting with?
Should I keep talking?
Yes, You're the
So-
one talking. If any of you want to chime in, raise your hand and Nancy will call on.
So rebalance. For
Okay,
sure.
what comes before rebalance?
What would help before rebalance?
Rest.
What
Um,
Rest assess.
Rest assess.
oh yeah, sorry. That's the
Literally the
that is a
most
given.
important thing on the menu. Never get tired of saying, don't never say, I assume rest assess. No, it's part of the map. You always-
Right, that's the stuff.
I mean, here, I'll even show you guys. Look at this. I do my own maps. I know I have to do a rest assess. I write it down.
Cool.
And I write in, I also write in my rest reassesses. That's what RRA is. Okay, so never just assume, you gotta write it down. Okay, rest assess. And again, this, I would say, Barbara, you go in with intention, intention, intention. This isn't just your cookie cutter. I learned it in melt class. Rest assess, you want to speak to your person. It's a personal, personalized, with intention, right? Okay. Next, rebalance. And we want to try it on the full roller.
Yeah, unless she feels nervous about it, you could use the half roller.
I think she'll be fine. I really do, Barbara. That's like literally not a concern to me at all. I think she'll do fine on the roller. And if anything, it's going to be what are some great cues that Barbara can use with her to get her to really have a great experience with the rebalance sequence? What are some things she could, as she's doing things like gentle rocking, what are some things she could cue her on? What are some great multitask cues she could give her?
Well, like you cue make yourself one with the roller, or Velcro let the roller, just making sure. I hate using negative, but sometimes you have to say, please don't move your body across the roller. Let the roller and your body move as one.
Yeah.
Liz has her hands raised, so I'll be quiet.
Be the roller, be the roller. Yeah, but what else can she notice, when she's doing gentle rocking? What happens with the abdomen? Ages, right? So notice little things like that as she's rocking, notice that subtle engagement. Because actually, and I know we seem to do this a lot, but if somebody, and Bruce mentioned, the rebalance is going to be an important one for her. You might want to tuck it in at the end too, just to see if she has as a reassessment, more as a reassessment, not less as a finishing sauce, more as a reassessment. Okay. So full rebalance. Do we want to add anything to rebalance or just have it as a pure rebalance?
Tuck and tilt.
Yes, that's part of rebalance.
Okay.
You could do some shoulder blade shoulder girdle gliding,
Shoulder
and
okay, with shoulder blade reach. Love
shoulder
it.
blade reach. And also I like the neck turn.
Neck turn reach.
Yeah. And then move, but then after that I'd stop. I'd move on to the lower body after that, because it sounds like you have an hour session.
Okay. Yeah. I think we're going to try something new with her though, right? We're going to try something new and maybe do just a 60-minute session of pure melt.
Yes.
Of just melt.
Denise has something to add to that too.
Okay, go ahead.
I just had a question, but I think you answered it, because she's saying she does cranial sacral work first and then does about 40 minutes melt. So this is no cranial sacral therapy first.
Correct. And actually she
Right.
does the opposite. She only does about 20 minutes of melt and 40 minutes of cranial.
Oh, okay.
I'm saying just completely different, especially since she's a case study, and say, let's just try melt today and see how we do.
Okay. I really, really, really love the idea of introducing single leg lift just to see how her body responds. Maybe you can do it at the end too, but just maybe lifting a heel and then the toe, let it hover and just see,
Okay. So
how she's dealing with that.
Option 1 is with length. Option 2, I love that. Single leg lift. Do not do them at the same time. I would want to give her more time to really think about her rebalance. So I love that, Denise. I love the idea of maybe even saving the length for later. That's just me. But it doesn't matter. You can play that one by ear. I love it. Yes, single leg lift. Get that ground force reaction, neurological communication from head to toe. Awesome. All right, so we've gotten rebalance off. What do we do after we get off the roller?
Rest, reassess.
Reassess.
Rest,
All right.
reassess.
All right, all right. Okay, what's next? She's done that. Do we want to stay? Do we want to work from top to bottom? Do we want to skip around? What are you guys feeling? What does she need? Remember, she's got a lot of grief and she's got spondy.
I mean, I'd like to do a little upper body first. Maybe.
Okay.
I would do the pelvis.
Okay.
I would do the pelvis first.
All right. So we've got how many other people for pelvis? Nancy, you got
I would do lower body compression first and use the pelvis as my rinse so that she doesn't have to figure out the rinse on the lower body.
I love it. So lower body length, you mean, as the rinse?
Yes.
Okay. Awesome. I love it. So let's get to it. Now, here's my question. Denise, not Denise, I'm sorry. Barbara, do you feel comfortable with her getting on her side and doing inner thigh?
Yeah, I do.
I say let's do the whole thing. Inner thigh, back of thigh, calf. Even if it means it's just like one spot, but I would do lower body compression. Rooted core, rooted core, rooted core. Get it in there. So we're going to do inner thigh, back of thigh, calf. Okay. And then you guys are saying you want her to then get the roller under her pelvis, yeah?
Yes.
Okay. So then we've got, okay, so then I'll just put like a little thing here. Roller under pelvis. So you're getting right to it. So you just cook right along. Okay. And we are going to do, what do you want to do the minute she gets the roller underneath her pelvis?
Second tilt.
I would do the tuck and tilt, yeah.
It's just to be clear, it's modified.
Yeah.
Okay, you guys gotta remember this stuff. Modified TNT, because what are we trying to do when we take someone through a modified tuck and tilt?
It's an assessment.
Yeah, what are we assessing? What are we getting them to understand?
Pelvic differentiation.
Really, because remember, every move that's done with the roller under the pelvis, it's 100% reliant on proper pelvic positioning. So if she sucks at doing it, she's gonna have a hard time sensing it, right? So
Yeah.
yeah, differentiation. So Barbara, you're gonna learn a lot in rebalance. Really pay attention to pelvis. And just make sure when you are cueing her through this, that you really get her to understand the difference between tuck and tilt lengthwise on the roller versus tuck and tilt with the roller under the pelvis, because it's different, right? It's a little bit different. You can tuck that pelvis, feel the hip crease go away, right? Feel that line of pull in the front of the thigh. But then to tilt, we're just going to untuck the pelvis and go right back where we came from. Let that pelvis get heavy on top of the roller. You feel that abdomen engage and really get that idea of sinking into the roller. That's an important delineation so that she understands it. Otherwise, you want to set them up for success. So educating them here is really awesome.
And I just want to say, I've gotten, maybe it's just my clients, but I've really dropped the word tuck and tilt because a lot of people can't understand it. I have been using tailbone towards the belly button and tailbone away, and that seems to be helping with that, landing the tuck and tilt.
Okay, it's I get it. Yeah, that's like Sue saying happy bunny and sad dog. Same idea. I love it. Okay, so we've done that. Now what?
Well, it all depends on how she performs that. So you might have to spend more time on it, or maybe switch to a half roller. But after that, if she can do it well, maybe take her into a bent knee press.
What do we want to do before then?
Get a little hydration in the pelvis with the SI joint.
That's
Yes, I don't care.
So fair enough, fair enough. If she really can't move that pelvis of hers, she's gonna struggle with some of the length moves, right? But at a minimum, you could do SI joint shear. So I think really noticing how she's navigating that is awesome. And then there was something else I was gonna add to that. Doesn't matter. All right, so we got SI joint shear.
And I would keep it simple. Just pick one way to shear, because if you're nervous of her being on the roller, just like keep it simple, wouldn't you say?
I don't think it really matters. You're just giving her options.
Yeah, okay. We are, because it might be that one is better than the other.
I would say I'd hit the SI joint twice. And you can, Barb, I'd be right there with her. You know, if you want to work with her on the, I don't know if you want to work with her on the table. I don't know. With a full roller, you can't. With a half roller, you can. But like being right, like you do the knees, you guide her, you're there, you're looking her right in the eye and always giving her all that, like letting her know she's safe, she's with you, you've got her, right? Like just be super present in that way. And hit it both, like just try with the two knees and say, let's see if you could just do one knee and watch her ribs. That's the other thing, is like, watch the rib positioning. I bet her ribs are probably pretty fixated. You know, I mean, is she, Barbara, is she kind of like this? Is she a little kyphotic?
a little bit, yeah.
Yeah, of course, you know, she's got a broken heart, right? So we're not ready to rib length her and have her sob quite yet, but you know, rib length would be a great thing in the future to add to her world, as well as sternal decompress when she's ready for that. Okay, so we've done SI joint shear. What next? Do we want to try tuck and tilt challenge?
I would think maybe because if she can do the SI joint shear, she probably can do the bent knee press.
Okay, so you want to add that next? Do you want to get a little length in there?
Yes.
Okay, because we could end it right here. It's the first
That
time.
might be all you have time for.
Yeah. I mean, as it is, that's pretty good. We're missing an R. So we could try it here, but that would mean doing tuck and tilt challenge, or Barb can go back to doing the neck release.
Release.
Yeah, what do you guys want? If this were your client, what would you do next?
For an R, I would do a neck release because she's used to cranial sacral work.
Brilliant.
So
Okay, so then we're gonna do an RRA in here then. Okay, how's that? Nice and simple. First time roller under the pelvis, we're gonna keep it, we're gonna get in and get out. Does that feel good, Barbara?
Does.
Okay. Okay, awesome. So she gets, and this is a great opportunity for you to educate her on length, you know, compression versus length. We're gonna compress and then we're gonna lengthen. It's gonna be lovely. Great. And that, and just really get her in this rest reassessment. What are some things Barbara really wants to get her client to think about? What are some things you really want, like the minute she gets off, what do you want her to notice?
The shape and size of a low back curve.
I would say so. That's the most direct, right? Because it's her low back, that's the problem. So get her to really tune into that and notice any difference. So just remember, if this is something in the beginning, that's, she wants to talk about that, right? Because we're about to go into here and do this whole sequence. So have her really point out her lumbar curve, her low back. I would even say, notice her neck. So have her notice her spaces, right? Her secondary curves. Have her-
I like to notice how you feel lighter, but you feel more grounded. Like instead of just being like all masses, just all over the place, is heavy on the floor, you sort of feel elevated, but still like more grounded. I don't know how to say it.
Well, I
better.
think just tuning into those 4 common imbalances, right? So we're always going to come back to that anyway, and really just notice those, like if her shoulder girdle really was kind of propped up on the shoulder blades, just notice how it's more splayed out, but it almost feels light. It doesn't feel heavy. It feels like less effort. Is that a better way to put it? Like there's not as much tension. It's just kind of
Yeah, more open.
more open. Okay.
Yeah.
I like
yeah.
the undulation of the body also.
Yeah, undulation. Yeah, the undulation of the curves. Yeah, any shift in the waves, right? Low back curve, and then I would have her tune into that, and I'd say, now turn your head from left to right. And just really have her notice the indirect effect. Just kind of a wowza thing. Beautiful. This is a great map. Okay, so let's say Barb has 15 minutes left. How do you want to wrap up this session?
What about
The neck release.
rebalance?
All right, some of you said.
Oh,
neck.
sorry.
Wanna
We
do
had
neck?
talked about doing a neck
The
release.
neck, but maybe the full like jaw, the temple, the jaw, the full on
You wanna do the face?
facial.
Okay, with the face treatment?
Yeah.
Okay. And if there's time to throw in, without even RRA, just throw in one more time, a little mini rebalance as like a reassessment. Notice her tuck and tilt. Oops. TNT. I'd even say notice her gentle rocking. It's easier to do. Take a couple more breaths in here and then reassess. I would say one of the things also I meant to say up here is I would cue her to, so only time you do it, take a deep breath. And notice if she's stuck on her inhale or stuck on her exhale. If time. I love this map.
Amanda, one thing I was going to say in conjunction with what you said about the rib side bend and the sternal release, a slightly less intense, but I feel the same way, is the seated version I do of the neck side bend. I just have people do it completely sitting upright. And yeah, and you get that same pull opening through the heart and the chest. I think that could be good. Maybe not right away, but definitely down soon.
Okay, I love it. Anything on here that, Barbara, how do you feel about this?
I feel like I could do that with her.
I love that. Woo! That's what I wanted to hear. That's what I wanted to hear.
I just needed you guys to say it was okay.
It is okay. It is more than okay. I think you're gonna rock it. Like, I think it's really in your communication, how you say, I want to try something totally different next week. Are you okay with us just getting on the floor and doing some melt? I think it'd be really great for you. And that way you have, and all I'm going to give you for homework is rebalance. That's it. That's all I want you to do, that along with your hands and your feet, which I love that you do every day, but I want you to add this in. And, you know, I don't know how open she is to things like mantras or, you know, just maybe putting some beautiful music on while she does it, maybe diffusing some essential oils, those enhancements, you know, the enhancements, really, we want to quiet her stress reflex and, you know, support her in her grief. We can't get rid of grief. Can't get rid of it. I will grieve my father for the rest of my life, right? So that's just how I am. That's my experience. And I don't apologize for it. I don't care what anybody says. It's been my greatest lesson in life. I can't even, I'll never be able to imagine what she's going through because I have no children. So I don't understand that at all. So being able to support her in this. And Nancy, I want to ask you, because if it's okay, Nancy's, you know, had some recent profound loss in her life. And I just would love it if you would be willing to sort of share anything based on this woman. Did you see her history? Did you get in here in time enough to see that?
Yeah, I was just wondering, first of all, when was it her husband that passed or what?
And her daughter here. So
Both?
her daughter died about 2 years ago at 30 from pancreatic cancer. And then the husband died shortly.
Wow. Yeah.
Pretty intense.
Yeah, a couple of things I was going to say about that. That is intense. Rebalance. I mean, I lost my husband, and then 4 years later, I lost both my parents within 4 months of each other. And then last year, I lost my sister, who I was very close to. So, I mean, even just thinking about it now, you know, just saying the words, you know, brings up all that emotion again. But getting down on the roller and doing a rebalance, even gentle rocking and breathing, you can recommend to your client also, Barbara, you know, maybe do it before bed. I mean, I know Sue says, you know, do it up to an hour before you go to bed. I do it before I go to bed. You know, I do it when I wake up and I can't get back to sleep. I do it again, you know. So for me, that's what works for me personally. But maybe having her do it not just like when she would normally do her hand and foot, you know, have her maybe split it up and do the hand and foot when she usually does it, and then doing the rebalance in the evening. But melt is definitely going to help. She'll probably have emotional releases. It's part of that healing transition. And it's really good. The more you get all that out, then you feel cleansed. So the other thing I was going to say about doing the tuck and tilt, and I think Michelle has a question because she wants to know the difference between the tuck and tilt on the roller versus when you're doing like the tuck and tilt for gentle rocking and then tuck and tilt. But the thing is, I wanted to ask Barbara, when you're with your client and you're doing melt, do you actually physically put your hands on her?
Yes, I do.
Okay. When you do that, you know, always create your little bubble so you're not taking on her energy, as Amanda was discussing before. But, you know, doing the tuck and tilt when you get the roller underneath the tail triangle, sitting in a chair, holding her feet. I mean, you do cranial sacral, so you know how important the feet are. So you can actually, you know, notice what's going on in her body through that. Just holding on to, you know, the modification when you sit in the chair and then they do the tuck and tilt on the roller. So, I mean, you could place your hands wherever you feel necessary. But it is a very emotional time. I mean, I still, when I do Carrie's groove classes, at the end of groove, sometimes I just start crying. It's been a year for my sister and many years for my mom and dad, and my husband, but, you know, it still comes out. And then it's like, you know what, that was the best dance session ever. Or even in melt, that was the best melt session ever because I got it out. So good luck. I feel for you. That's really sweet.
Thank you, Nancy.
Yeah, and Nancy, one of the things, because you came in later, Barbara was just feeling like hesitant to do a lot of stuff because she's like, I don't know, can I do this with her spondy and all this? And so that's why I said like her spondy is like totally manageable in my view, right? Like
Yeah.
it's this stuff, it's the grief that's pretty intense that I think. And so I was wondering if Barbara's fear was more out of like something going on with her that maybe is a hard thing, because grief knows grief, but sometimes you don't want to go there, you know, because this is like, I couldn't understand that. I mean, all I could do
Yeah.
was present, but I would be like, I might cry with you today. I hope that's okay, you know?
And grief will manifest itself in those areas that she's having dysfunction or, you know, some issues with. So it's going to manifest there. It's just very easy for grief to go right there. So being there for her and understanding, but not taking on, you know, you can cry. Of course, we all have emotions and empathy, but just understanding that, you know, if you did that with all your clients, you'd be sleeping 24/7, you know, it'd just be too much. But yeah, and again, I always say it's the metaphors, you know, what's the pain in her back, you know, the pressure and her knee, taking her next step forward after all of this, you know. So
Wow.
yeah.
Wow, that's a great, did you guys hear what Nancy just said? The knee, the cranky knee, her left knee, right? And that she's been getting cortisone shots in the last 2 years. 2 years ago, isn't that when she lost all of them? What a profound thing Nancy just said, being able to take a step forward. Like it's too terrifying to feel like she can move forward. And so she's almost paralyzed in her moment. And I think, you know, it seems like maybe I'm wrong, but like she spends a lot of time with friends and she does a lot of travel to keep herself busy, right? That's also avoidance. It's like some people take to the bottle, some people just fill their calendar with everything they can to not think about that thing that will never go away. And sometimes you got to suck it up and think about that thing. Otherwise, you know, I think that's such a great point you made, Nancy. Thank you for that. Because we had somebody in Thursday's group, a gentleman who's had 7 dislocations in his right shoulder. Now he's a tennis player and all that, but he's got a daughter who's like a teenager, maybe not quite, who lives in Italy. And he does not, like, his ex and him do not, it was very, very bad. They do not get along. She's apparently very difficult. And I don't know what the story is. Did the ex take her to Italy? And the guy, they were never married. So I guess he lost custody. And it's like, I'm like, it's as if that detachment is that dislocation is literal and figurative. Like it's manifesting in his shoulder because he's separated from his daughter. So I think what Nancy said is so profound in that way. So I love that. We're just about at time. So if you have to go, I totally get it. And let's see. Oh, you've got to go. Okay, Bruce has to go. Liz has to go. You love the Proclaimers. Yeah, I know. How can you not? So this is great. You want to revisit the difference between TNT and the roller and TNT on the belt. Okay, so we will. Anything else that you want to offer Barbara before you take off, you guys leave? Anything else you want to offer her? Any words of encouragement, advice, anything?
Just to say that she's chosen you to help her, so let her.
I want to thank you all because this has really been so helpful for me. It's, you know, really boosted my confidence in what I do, what I'm supposed to be doing.
You're a pro. You know what to do. You were chosen to be, your vocation is to be a healer, right? With your hands-on work. When you guys are teaching someone how to heal themselves, how to help themselves, you're the Sherpa. You're a Sherpa. You're guiding the way. You're saying, let me show you what you can do. I'm here to, I'm gonna be with you every step of the way. I'm here to hold the space. I'm here to hold you. But this is, yeah, I think it's great. looks like madness on here. I think it's fantastic. It's great.
Have faith in yourself, Barbara. Have faith in yourself, not fear.
And eventually, Barbara, I'm going to encourage you once, I mean, this is a big map, but I think it's a good start. And then eventually I'd love to see you start adding in some neuro strength with her, just like a little move. Just have her do, once she gets, it feels good with the roller under the pelvis, maybe tuck in a little mini bridge, you know? And that'll be fun for her to try. I would ask her again about like exercise. Like I would make sure, especially at her age, she needs to be adding some load. You know, that's going to be important for her to do. Just to maybe find a personal trainer or something like that, just to help her with some basics of weightlifting and stuff. It'll also make her feel confident and powerful because now she's on her own. Having a sense of confidence and independence is great. And like, that's something my mom got into after before my dad died, she started doing it, but she really became her sanity was going to the gym, walking on the treadmill and doing the little circuit. Those single joint machines are stupid, but you know what? It doesn't matter. She was in her 70s and she was moving and she was getting strong and you know, she ended up breaking her hip, but not badly. And I think that had a lot to do with it. So it's important that she does strength training to protect her.
Can I ask Barbara a question too? Does she live in the country or city?
Lives in the city in Chicago.
Oh, downtown?
Yeah.
Right. Well, I mean, even taking a lakefront walk, getting out in the fresh air, if there is any left in Chicago. But, you know, getting out for a walk in the sunshine, you know, by the water. Water is very emotional. It also has those negative ions that are very healing. So if she can get by the lake, if she's anywhere near a lake or any body of water, to walk near the water, you know, in the summer, maybe take her shoes off at the beaches. I grew up in Chicago and I know there were beaches. I don't know if there's still any beaches over there, but, yeah, get outside. Right. Pardon?
There's just no sun anymore.
I know, but getting outside, you know, and breathing would, I mean, that just came to me for her that she needs just to get some greenery and, you know, life back in her.
Yeah, you reminded me of some stuff that she could look into enhancement wise, like stuff to add on top are like those salt caves.
Oh yeah.
Yeah, Chicago gets so damn cold too, right? Maybe infrared.
We have King Spa here. Do you guys have that?
Mm-hmm.
Oh my God, it's amazing. I go there all the time.
If she's not claustrophobic, floating is amazing. Those salt pools to float in. Oh my God, I love it. There's one right near the new gym where I'm going to be massage therapy. I just need that.
Good word.
But like because it gets so dark and kind of cold and miserable in the winter, adding in red light therapy, like even just a little one to have to stick her face in is going to help her with depression. I know people like my friends Ryan and Luann, they actually bought, like they ordered it and had it shipped over. Bye, Marlene. Bye. An infrared sauna that they have in their house. And they just get in there during the winter. It's just really, I mean, and they're talking about grief. They just lost their son last January. So that's a big part of their healing and going to the water. They go to the ocean every single day. So like Nancy said, the water is really great. But yeah, just think about offering those as suggestions of her to, again, I know she wants to run away and not think about it, but it's always with her. So she can't, it's the elephant in the room. So, you know, she can support herself and meet herself where she's at in that grief, like meet the grief, make space for it, choose to use it as a superpower. I mean, I don't know how open some people are. I would recommend a book. She check out both books by Laura Lynn Jackson. One is called Signs. That's the second book. The first one is called The Light Between Us. And it really, I found it very helpful, you know, just as far as they're always with us, right? We're all energy, just in different forms, right? And the other side, Laura Lynn Jackson's like, if you hold up a piece of paper and you say, where's the other side? Well, let your fingers that are holding that piece of paper are also on the other side.
Yeah. Natalie has a comment.
Sorry, go ahead, go ahead, Natalie. I almost said,
It's actually, first of all, that's very, the second part of this has been very, very helpful for me, like understanding trauma and what we do to just keep going, like to put one foot in front of the other is just amazing. Like, so the strength, I think you talked about that at the very beginning, Amanda, but also just recognizing that they don't, like, all she cares about is getting up out of bed and what am I going to do today, and filling up the day with work and appointments and whatever she has. But sitting with grief and sitting with that is the hardest part. So I just, and I've never thought about it as, but of course I have, but thinking about how it impacts your body. Like I know that, but I think that was just really helpful. I have a personal question. Can
okay, I can stop the recording
Okay.
Okay. So Barbara, I hope this was helpful for you, and I look forward to getting an update. We all do. Add it to the Facebook group.
But Barbara, I want you to hear my question so that you understand where I'm at.
Okay, do you want me to have it on the recording or no?
Not really.
Hi, private.